Okay. Hi everyone, this is Dr. Mansi back again on the Beyond Boundaries with Homeopathy 360. And today we have Dr. Heena Siddiqui ma'am on the podcast series of tips and tricks to crack AIAPGT. And we have another brilliant mind today with us, that is Dr. Heena Siddiqui, BHMS, DKMMH, Aurangabad, Maharashtra, MCEH, the Other Song Academy, MD Repertory, NIH, Kolkata. AIR 13 EWS, first in Maharashtra in 2021, AIA PGT. We are really very, very proud that ma'am, you got selected in the NIH Kolkata, and it's my honor to host you on this platform. And again, we are going to learn from your experience, from your tips and tricks, exam in the field of homeopathy. That dream for this seat in the government college in all over the India. And today we are going to listen from the speakers that are already that have already cracked this exam. A very warm welcome to you, ma'am.
Thank you so much, Dr. Mansi. And I'm really very honored to be on this platform. And I'm very happy that I will be able to help students with my experience. So I would like to personally thank you a lot for taking this initiative, for starting this series. And this is going to help a lot of aspirants. So,
Yes, ma'am, sure, definitely.
Talking and knowing from someone who has already experienced it, definitely
Yes, ma'am.
it's a huge difference. So
Yes.
a big congratulations to you and your team for taking all this initiative and efforts. And thank you so much for inviting me. And I really hope this session will be fruitful for all the aspirants.
Yes, ma'am, definitely it will be very beneficial for all the participants. And I would like to mention that Dr. Hina ma'am also share her clinical insights and her tips on Medica and even on the other subjects also on her social media and on different YouTube platforms, and which are also very beneficial for the students as well as the physician. Ma'am, would you like to mention your channel, please?
Yeah. I have my YouTube channel with name Healing with Hina, where we are doing a series right now, which is Rapid Revision Final 50 for AIPGT Preparation Strategy. We have already done live sessions. It was 24th day today of live session. Every day we are doing PYQs and all rapid revision, high yield topic and everything, all this discussion we are doing. Healing with Hina.
Thank you so much, ma'am. Your work really inspires us, and your dedication towards educating homeopaths and the students, it is a very commendable. We are very thankful to have you on this platform today. So, ma'am, let's start today's session on tips and tricks to crack AIPGT. Ma'am, let's start with the very first question that I asked with all the speakers. Ma'am, how do you feel when you saw your result on your computer screen? When you saw your rank, you have so good rank, ma'am. It is really very appreciable. Ma'am, so how was your feeling on the result day?
Oh, I can't explain that in words actually, because all the efforts you put, all the hard work, so long of a long duration, you keep on trying, and I never expected this result. I just wanted a government college, not even NIH. I never expected
Okay.
NIH or this good result. But yeah, I gave my 100%. I did hard work, and when I saw my result, the very first thing I could do was start crying because I
Oh
was
God.
all those efforts, all that was like a flashback, all those months of hard work, And, that all came in flashback, and I was so grateful. Finally, I did it. So that was the feeling. I was very happy.
Yes.
And, it was like a proud moment, I could say, for my parents, my mom. So yeah, that was very emotional moment.
Yes, ma'am, we can totally understand because, ma'am, we all understand that this exam carries so much importance in all our lives, in the lives of homeopaths, and this exam requires so much passion, so much dedication, and lot of efforts. So we can totally understand it's the moment of emotions and proud feeling. So those all tears are of happiness. Okay, ma'am. Let's begin. So, ma'am, would you like to share your experience on how early should one start preparing for exam for homeopathy?
See, this is actually very important question. Many students ask this, and they are confused from when to start, and when to start revision, when to start actually practicing, when to join mock test. So I would suggest that if you are really into PG, you are very sure that you want to do PG, you should start your preparation in internship itself without taking a gap, 1 year gap, or a break. It is really good if you do it continuously, because everything you have done in BHMS is still fresh in your mind. In internship, you have time, so you can read and you can have a clinical experience, practical experience of whatever you are reading in the book. So I think internship is a period, very golden period, I would say, where you get the chance, where you have time. So from that time only, if you start to prepare, if one start to prepare, if one joined a good test series, and start every day, if they even read for 2 hours, okay, that will be sufficient. So as early as possible, I would say, जितना जल्दी start करोगे उतना अच्छा आपका result आएगा. Consistency is the key, I always say. So yeah, as early as possible is the answer for when to start the preparation. And if you haven't start, जब आपका mind में आ जाए कि मुझे PG करना है, that is the day आप start कर दो and consistently prepare करते रहो, definitely you're going to get it. So whenever you decide कि yeah, I want to do it, that is the day you should start your preparation, but consistency is very important. 2 दिन पढ़ लिया, 3 दिन छोड़ दिया, then that is not going to work.
Yes, ma'am. So, ma'am, when did you started your preparation?
Oh yeah, I started my preparation in it was before exam. I think it was 8 months before exam. It was 8 months. I started my preparation, and it was like I didn't do a full-fledged preparation for 8 months, because I was doing job. I was working. I was assisting a dermatologist. So in morning I used to do that job, and also I had, after internship, I started my practice. It was not like I completed my internship and then only I got into PG. It was a gap in between, because in Maharashtra the situation is like we don't go for PG. Usually we are into practice. Most of us are into practice. So in my mind was also like I want to start practice after internship. So soon after internship, when I was into internship, I completed my master's course in advanced homeopathy from Other Song Academy. And after that, I started my own clinic, started practicing. And because of COVID, I made it like just part time in evening hours, few hours. So in morning, I used to assist a dermatologist. I was working there, and evening for 2-3 hours, I used to sit in clinic. And in between that, whatever time I used to manage preparation, that was going on like for 6 months. And when the date was declared of exam, so after that last 2 months, it was just me and my books in my room. Nothing else. I quit that job. I stopped seeing the patients. Nothing else
हाँ,
other than study.
हाँ.
So that 2 months was the
Okay, okay.
full-fledged preparation.
Yes, ma'am. And I guess to crack the government seat, it is required that much efficiency and consistency.
Definitely.
All right, ma'am. So, ma'am, next moving on to the next question. What books or resources do you primarily use for preparation? Can you please suggest some?
Okay, when during my preparation, I studied from, as I always say, I always suggest to student, it is success. All the 3 volumes, it is now 4 volumes. Earlier it was just 3. So all the 3 volumes of success and turning point.
Hmm.
For Materia Medica,
Okay.
I used Crack the Entrance.
Okay.
Yeah, that all this. And mock test series
Okay.
I had joined, so that.
Okay. So, ma'am, sometimes I have heard from few participants that they also try to study from our basic books, like for the pathology. They started the, uh, reading again that whole book, and for anatomy, whole 4 or 3 volumes they want to study. So, ma'am, is it important or is it required to again read our basic books, our syllabus books?
See, it depends on your concepts. You know, if you
Hmm.
have studied well in BHMS, if all your concepts are good, then you
Hmm.
don't need to go back and study whole book again.
Hmm.
Okay, just
Hmm.
studying from the competitive book is enough. Okay, because even
Okay.
if you read from the textbooks, that
Huh.
is not going to help you. Because reading from
Okay.
textbook, you will not know how the MCQ will be framed from this line. What question
Hmm.
could be, they can ask from this chapter or this topic. You will come to know about
Huh.
that MCQ or the type of question or the pattern
Hmm.
only after you read
Huh.
competitive books, only after you solve
Hmm.
MCQs, only after you start giving mock tests. Okay, so
Hmm.
reading for a theory exam, what we give in BHMS, UG, and reading or
Hmm.
studying for a competitive exam is totally different. Textbooks are good for UG or for any theory university exam, but like competitive books are necessary or a must for cracking a competitive exam like AIPGT. So I would not say that I would not recommend anyone to go back and study whole books, textbooks again, because
Hmm.
I don't think that is going to help. But you should have your concept
Okay.
clear. If you don't know
Huh.
something, any topic in detail, you can just go and revise it definitely. And now, so we have so many options, online and YouTube videos and other so many things. Now, the students have
Hmm.
AI, which is, I think, a blessing if you use it properly. So all this, you can use this stuff to have your concepts clear. But using a
Hmm.
competitive books is definitely should be a priority.
Okay. 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 Thank you so much, ma'am. And ma'am, does the that we see that for the Materia Medica, like we have Ellen's keynote, and we see that Materia Medica is available in the concise form. Uh, that drugs are covered in 1 or 2 pages. So, ma'am, can reading from the Ellen's keynote, it help?
For competitive exam, if we are talking, just
Yes.
definitely it is going to help
Yes.
because the Materia Medica section, I would say, for
Hmm.
AIPGT is based on Ellen's keynote. It is based on Ellen's keynote. You will find that if there are 16 questions asked from Materia Medica, in that out of 16, 13 to 14 questions will be from Ellen's keynote. Okay, 1 question or 2 questions could be from Boric Materia Medica, and one could be from Ken's Materia Medica. But the base of the paper is Ellen's keynote. So yes, reading Ellen's keynote is sufficient to crack this exam, and that is must actually. if one says that they are not reading Allen's keynote and they know everything about the medicine, they have read it from Tyler, from Chaudhary, from Kent, from each and every textbook, but they haven't read it from Allen's keynote. So I can give you in writing, or I can bet that they will not be able to answer the questions in exam, because the questions are 90% from Allen's keynote. So yeah, it is sufficient if you are not reading any other book and you are just relying on Allen's keynote. So yeah, that will help you, Allen's keynote.
Yes, ma'am. I'm asking this question just because, ma'am, I have seen that in many year papers, we have the questions from relationships only. That
Yeah,
this medicine should be taken from this medicine or not. And we have the questions on analogs, chemical analogs or vegetable analogs, and the complementary antidote. So I think, ma'am, that relationship part is also important, I think.
most important. I always say that
Yes.
for materia medica, the important
Hmm.
thing is you should know all the common name of the remedies, all the remedies. You should know the
Yes.
family of the remedies and the
Yes.
relationship section. This is the
Hmm.
part where which is going to give you high score, because
Okay,
questions
okay.
are asked from this part. Definitely.
Hmm.
Every year you will see at least 3 to 4 questions are from relationship section,
Yes,
from
yes, yes.
family. They ask you match the following. On common
Huh.
names, they have question of match the following. So these are the
Hmm.
some questions that these are the topic which are easy, to know,
Hmm.
to memorize, and they will help you get a good score. So you should definitely not miss this part while reading Materia Medica. And the rest is for the Allen's keynote, all the part.
Hmm. So, ma'am, as we are talking about the families and common names, I would like to mention about the book "Crack the Entrance." That you can find the very detailed information for this type of question in the theory part of this book. We can see the numerous tables having the drugs names and their analogs, their chemical analogs, their families, even their common names they are given. So that that book will be very helpful for the materia medica in the comparison study.
Yeah, yeah. If one is using cracky entrance for materia
Hmm.
medica, that will be sufficient. And the success
Yes,
in
yes.
success, they have these lines,
Nah.
lines from questions from Allen's keynote. They have a few questions, I think
Uh-huh.
400 or something questions are given. If you solve that much
Okay.
question, you revise it again and again, that will be enough.
Hmm.
Even from Boric, they have
Oh.
there is questions even in success. So that because
Hmm.
Boric is very vast, it is not possible to
Yes,
complete
boric is
it.
very.
So
Yes,
that,
yes.
reading that much will help you score good.
Ma'am, even today, after completing all the PGs and all, physicians still read boric.
Yeah,
It is
absolutely.
endless.
Yeah.
Okay, ma'am. Thank you so much for guiding on the books. Now, moving on to the next question. Ma'am, how did you divide your time between theory and MCQ practice?
Mhm. MCQ, see, theory is fine. You have to read,
Hmm.
you have to know the topic, the concept, what questions
Hmm.
could be framed. But solving MCQ, as I already said, is very important. So
Hmm.
what I used to do was in a whole day, I used to read theory or the topic, revision of
Huh.
the topic,
Huh.
subject wise. And
Okay.
in the evening, from evening, at
Hmm.
least for 2 hours, I used to solve MCQs. So that was, and in the morning, I used to start my study at 4. I'm a bit, early morning person. So I used to start it early. At early morning, I used to solve the old question paper, PYQs. So in morning, PYQs, at night, MCQs, and in whole day,
Hmm.
the theory parts. Whatever answers I used to get wrong, or I used to get confused while solving PYQs in morning, I used to study that whole day and then again solve MCQs related to that topic in evening. So that I'm sure now I have completed this topic. No doubt, no confusion is left.
Hmm.
So that way.
Okay. Okay, ma'am, that's also a very nice strategy. Ma'am, can we start the MCQ practicing from the very beginning? Like you have said that you have started your preparation for the 8 months.
Mhm.
So, can we guess that we can start practicing MCQ from the very first month, or
Yeah, yeah,
first?
it is fine.
Okay, okay. Because
It
ma'am,
is fine.
sometimes students follow the strategy like we should complete our theory first, and then we will check our ability to attempt the questions.
No, no. What happens actually?
Hmm.
You have already completed your theory in your
Hmm.
UG. है ना?
Yes,
You
yes.
have completed your
Hmm.
internship. That means you know your theory.
Ha,
Definitely, you
ha,
have
ha.
given
We know the
exam, you given
basics,
SME. You
like.
know basics, right?
Hmm.
Now, what you need to know is how they are going to ask questions from that theory part. Okay, if you
Okay.
are reading theory again, what is the point? You don't know what questions could be asked from this.
Hmm.
You will know questions only when you give mock test or you
Hmm.
start solving MCQs,
Hmm.
right? So solving MCQs from day one is very important.
Okay.
You know,
Okay.
because there's no other option than MCQs. You should
Oh,
solve thousands of MCQs before giving exam.
yes, yes. It's important. Okay, ma'am. So, ma'am, did you follow any daily or weekly study routine?
A lot actually. So
Hmm.
many routines because every week it used to get changed. Okay, is time this is not working or this is working well. So it used to get changed. But I was managing it with my job and clinic, as I told you. So it
Hmm.
used to be clinic. If I get time, I used to read theory. In morning, I used to solve PYQs. In last 2 months, I'm saying. And I used to solve MCQs in PYQs in morning,
Hmm.
and in whole day I have divided like chapter subject wise. Okay,
Subject
because
wise.
for me materia medica was a bit difficult. I
Hmm.
used to get very confused between drugs. So yeah, so at least 2 hours every day for materia medica. That was
Huh.
I used to give every day 2 hours at least for materia medica, and then a light subject I had divided accordingly because anatomy I never gave that much important. I just read whatever MCQs were given in success. Okay,
Hmm.
I never went back to theory and reading that 3 volumes was not at all practical actually. So I read
Yes,
it
yes.
because only two or one, two, three questions would be asked from that anatomy and anatomy and
Hmm.
physiology and all. So for me, I just focused on all the scoring subjects and that
Hmm.
like FMT, practice of medicine,
Hmm.
obstetrics, gynecology, then PSM. So I focused on these allied subjects and all the homeopathic subjects, materia, organ and
Huh.
repertoire, and pharmacy.
Hmm.
So two allied subjects, materia medica daily, two allied subjects, and two homeopathic subjects. So that way I divided it in a week, and then I used to change the subject, allied subject, next allied subject,
Hmm.
and that way. So that was a routine.
Yes, ma'am. That's also very helpful. And ma'am, for the subjects like anatomy or FMT, in which we don't want to study the theory again, we can learn or that part that sometimes from anatomy we see that many questions are coming from the CNS or from upper extremity. So we sometimes we learn that part from the MCQs, right?
Yeah,
Like
yeah, yeah. Repeated
when
MCQ
answer
will help.
explanation is given on the back side of the questions, sometimes we learn from
Yeah.
that part also.
Yes, yes, definitely. And when MCQs are repeated again and again, you know that gets fit in your mind. है ना?
Yes,
If even if
yes.
you know the theory, you missed it that point while
Hmm.
solving MCQ. But if
Hmm,
you
hmm.
make mistake once, next time you will not repeat it. है ना?
Ha.
So that's why MCQs are important. That's why
Yes,
MCQs
yes.
help.
Okay, okay, okay. Thank you, ma'am. So, ma'am, any high yielding topics or chapters you recommend not to skip?
As of materia, I already told you. Materia is all is important. Talent's keynote is very important. In that also relationship section. You cannot skip. You should not skip if you want to score good. And for material, all the family and all the characteristic symptom, like all the characteristic different characteristic of stool of different drug, urine of different drug, whatever given in crack the entrance. You can see you have that tables given in
Yes, ma'am.
crack the entrance.
As the
If
tables.
you read those tables carefully, that is very important. That is the high yield topics of materia, I would say. And for organon additions, different additions of organon. If you have turning point, if someone is having turning point, they have given a good chart of what all changes occur in different additions, because questions are definitely asked from that. So
Yes,
that's
yes.
another ideal topic of organon, should not miss.
Okay.
And Ken's 12 observation.
Yes,
Most
that's
important. Every year question are asked from that. So yeah, that is most important. Solving MCQs on that, because every year they change the style of asking the question. Answer will be same, but the question will be framed in a different way. So you should solve MCQs on this 12
12
observation.
observations.
Yeah.
Yes.
Yes, aphorisms are important, but they are a bit confusing. So instead of reading whole, just know from what aphorism what is important. Yeah, because in some aphorism you should know the footnote. In some you should just know what it is about. Okay.
Yes.
It is not necessary to know the whole aphorism word to word, but what is the gist of that aphorism should be known. So that is important. उसमें question definitely होता है. And what else? Yeah, FMT is most important, I would say. FMT ka in success they have given good notes. So yeah, if someone read that, they have given good tables and all about poisons, different poisons, actions, duration and all. So yeah, that is a high yield of FMT. FMT itself is a very scoring subject.
Yes,
Five
ma'am.
scoring subject which I will tell you is obstetric gynecology. That is very scoring because questions are limited actually, because topics are limited. If you know the topic well, you can answer any question from that. So obs gynae, FMT is another important subject you should not miss. And organ and repertory, pharmacy. These are 5 subjects which will help you score really well. Rest, material.
And ma'am, direct asking questions are from these subjects.
Those 5
So
subjects, yeah.
there is no chance of confusion and all if you have read that line very clearly.
Exactly. That is factual questions actually. And that will be only the answer. If you know it, you know it. That is.
Yes, that's it. That's it.
And from materia, they can ask it in different ways. So that will, even materia is scoring, that's not, but it will, that will be cheese on cake, I would say.
Yes,
And
yes.
so it will be like, if you know it, if you are able to answer all of the materia question, it will be good. But that is not possible, because at least 2-3 questions will be something like you will miss. Anyone will miss. So yeah, materia, practice of medicine, all these are like something if you know good, okay, but you should you cannot know it completely because they are vast subjects.
Okay, ma'am. Thank you again. So, ma'am, as you have already said that, ma'am, we have the question: what role do previous year papers and mock test play?
Yeah, I think we already discussed.
Already, yes, yes. I think, ma'am, mock test is also important to to analyze our preparation. That is it sufficient or not?
Mock test, it's not like you should start giving from day one. Even if you give it like once a week in the beginning. In the beginning of your preparation, if you give mock test once a week, it will be sufficient. But in the end of preparation, like now, for when you have only 1 month left, when you have only 2 months left for the exam, giving mock test every single day or twice a day will be helpful.
Okay.
जितना ज़्यादा mock test दोगे उतना you will know your position, where you stand, see what mistakes you are making, and you will learn from it. But yeah, one more thing is that all the online test series, they frame the questions, the difficulty level is very high. Okay.
Yes. Yes.
So if you are someone who is going to appear for the exam next 15 days, you're giving mock test today, and if you are not scoring very well, okay, because the difficulty level is very high, so you should not get very disappointed or disheartened. Know that whatever your score is coming in mock test, okay, you will get plus 50, at least plus 50 marks in original exam or the real exam, because here intentionally they keep the difficulty level very high. So that is something to be kept in mind. You should not get disheartened by seeing the score. Score यहाँ कम आएगा, but it means you are really prepared और वहाँ पर आपका score अच्छा हो जाता है.
Yes. Yes, ma'am. Yes, ma'am. Okay, ma'am. Moving on. So, ma'am, how did you stay motivated throughout your preparation, which is very difficult?
Most difficult thing that is, because whatever you are doing, if you are not motivated, so everything will be in vain. No use. There was nothing specific, anything I would say. I just wanted, I had this deep desire. I want a government college. I want to do MD. And just that was it. I had this in my mind that I don't want to disappoint my mom. I don't want to
Yes.
disappoint myself. And I just wanted to give my best. So I don't think there was any other specific motivation. But yeah, I had uh, uh, wrote on a paper and stick on my wall that I'm going to get a government college. This year, I'm going to crack AIPGT in first attempt. That was my goal. I'm not going to give any other chance for this. I'm going to do whatever it is in this attempt only. So, cracking entrance in the first attempt was my goal, and I think that became my motivation. कि दूसरा चांस नहीं मैं देने वाली हूँ खुद को. This is the time I have, and I have to do it. So
Yes.
maybe that kept me, that helped me.
Okay, ma'am, definitely. And even, ma'am, I think when we do such sacrifices, like you said, you quit your job and you cut it down your all the distractions. So, ma'am, when we sacrifice from our side, so those also help us to stay motivated.
Yeah, exactly. That time I remember I stopped using all the social. I was not on any social media that time.
Okay.
Yeah, but I just I used to use only this YouTube for
Okay.
for watching videos, for listening some motivational song or something. And that time I used to watch. You get that in the feed. You get something when you're watching something motivational or something related to study. You get same thing in your feed.
Yes, yes, yes.
So that time, I already had my channel actually, but I used to
Acha.
post on my YouTube channel. I already had, but I used to post only stuff related to different clinical topics. Okay, I used to just sit, make video, and post it that way, and that too very occasionally. It was not very serious, but I had my channel. But during that preparation time, on my feed, I used to see other other medicos vlogs. Okay, they used to post about their result, about their college and all. And during that time, I had in my mind कि एक बार बस crack हो जाए, and then I'm going to do this. So
Yes, yes.
that was in my mind. And then I think from there only, then when I went to NIH, then I started blogging and doing similar things. So
Yes.
yeah, you don't know from where you will get to, that inspiration, that desire. So that's anything can become motivation. So for me, that was also कि अगर अभी नहीं किया तो फिर ये रह जाएगा, ये नहीं हो पाएगा. So
और कि
that
like
also works.
बाकी चीजों के लिए हाँ, that's truly it's like मैम कि बाकी चीजों के लिए अपना टाइम भी आएगा.
Yeah.
Okay, ma'am. Next, ma'am, what are the most common mistakes AIPGT aspirants make? We can discuss first while preparing for the exam.
While preparing, the most common mistake is, you know, number one is using textbook, reading only from textbook and not reading from the competitive books. This is the most important and biggest mistake one can make, and people
Okay.
do make. I have seen students,
Yes,
they feel
yes.
like, no, we don't use competitive books.
Huh.
They don't understand this. They feel like using competitive book is something like, I
Huh.
read from my original textbook, standard textbooks. Okay.
Yes.
So yeah, I think that is the biggest mistake. Okay, that is not
Okay.
about in the pattern of exam. Okay,
Yes.
competitive books are there.
Yes, ma'am. They are meant for other purpose.
Mhm.
Yes.
Yeah, so that is first mistake I would say. Secondly,
Hmm.
not joining a good test series. Okay, self-study is good. You should do self-study, I would say. No need of, very hi-fi coachings and all. One can crack entrance by doing self-study. But
Hmm.
joining a test series for mock test is very important.
Yes.
So if you're not doing, if someone is not joining a test series, they are making biggest mistake of their life. Okay, they are
Okay.
wasting their time.
Hmm.
So that is another one. Thirdly, I would say that people do this thing that they will keep on studying like a whole time, and when it is like only 1 month left or 15 days left for the exam, they will either because of anxiety or because they are very panicked or because they are very overconfident. Okay, they will stop studying, or the energy they used to put earlier will become less during that time. So
Yes, ma'am.
both things are not good, okay? Because last 1 month is something which will make you or break you. I will say. कि अगर
Yes.
last 1 month में if someone has not studied whole year, okay,
हाँ.
haven't prepared very well, but they are giving their whole time, full-fledged preparation during last 2 months, 1 month, they can get a seat in any government college. So getting relaxed or overconfident in last 1 month is the biggest mistake. You should give your 100% or 200% rather, I would say, in last time. Okay, this is very important, crucial time. Should not waste it. And yeah, one more mistake is listening to everyone. I am recommending some books, you are recommending other books, someone third person is saying something else, and you are going to get all the books. You are not reading from a single book. So that is the
Yes.
biggest mistake. Should not read from 10 books. Okay. Better to read one book 10 times. Okay.
Yes,
Don't
that will be
learn
more
first
benefited.
10 different books. Yeah. That is most biggest mistake.
Okay. Thank you so much, ma'am, for sharing these mistakes so that our future aspirants will not make these mistakes while preparing. And ma'am,
Yeah.
can we discuss now the mistakes we do on the exam day?
Exam day pe to, we all are nervous. Even if you are
हाँ.
very well prepared, we get nervous, and that is normal, natural. So in that nervousness, avoiding eating, okay, going empty stomach in exam hall is, you should not do that. Okay, that is the biggest thing to avoid. Reading anything new in the morning or same day of the exam, that is a must. No, you should not do that. Okay, you should not keep any important topic to read on the same day. That is again, you should avoid. And yeah, and during while solving paper, I would say that not reading questions properly, or getting overexcited while reading, or reading a question which you know very well. You get happy ना कि "हाँ, ये वाला तो मुझे आता है."
हाँ.
But then
हाँ.
वहाँ पर एक छोटा सा twist कुछ हो सकता है. There might be
Yes.
something, a different option, a different word, you know,
हाँ.
or something about, all of them, but they are asking all of them except
Ex.
something. A word can make a change in the question. So getting
Yes.
too excited after reading question is not a good idea. You should be very calm. You should read question very carefully, options very carefully, and then only you should attempt, because few students forget this thing that there is negative marking and they keep on answering all the questions. So what happens? Because of that negative marking, you lose all the marks which you have scored already by giving correct
Okay.
answer. So don't get overexcited. Don't don't have this thought that I'm going to solve all the 120 questions. If you are answering only 100 questions, okay, or 90 questions, say, very confidently, okay, and correctly, that is sufficient. Leave those 30 questions. Don't think about those 20, 30 questions, because 20 questions are such that no one will be able to answer. The difficulty level is that high, okay, in that 20 questions. So, having this thing in mind that I'm going to solve whole paper is one should not do this thing, okay? So yeah, and not checking your answer again. That also happen. You have to save and then next. For
Yes,
every
yes.
answer you have to save and next. So,
Yes,
and
ma'am.
very
We have the options for review and for the
review, yeah,
pass, and
yeah.
we have some color markings there.
So some students keep it for review, and then at the end they forget to save it. So what happens, even if your answer is correct, that will not be counted if you haven't saved it. So that is something you should not do. You know?
Okay, okay. So, ma'am, how will you explain that? How can we deal with negative marking? Should
Negative
we
mark.
should we totally avoid that question, or should we take the risk? And if we are taking the risk, for how many questions should we take the risk?
See, negative marking is something if I'm reading the question and I have no idea about it. कि what is the question, what are the options, कहीं दूर तक भी याद नहीं आ रहा है कि I have read this somewhere. Okay, so then there is no point of reading it again. Just skip it. Completely skip it. Okay, because even if you guess, that will be a wrong guess. Okay, so better to skip that question. But yeah, if there is some question where you feel like you have read this, you have idea about this, but you are not sure about the answer, or if you are confused between two options, so in that question you can take a chance. Okay, you can use elimination method. Okay, between two options, ये हो सकता ये नहीं हो सकता. Why? Give a bit time for that question, and then there you can get it. Take a chance. Okay. So probability will be like 50-50. You will get it or you will get it wrong. Okay. But अगर सही हो जाता है तो there will be 4 marks, है ना? अगर wrong होता है तो cut होगा, but then अगर सही हो जाएगा तो it will be 4 marks more. So in that case, you should definitely take a chance. But if you have no idea and you're going to make a wild guess, that's not a good thing to do. You should skip it completely.
Okay, okay, okay. And ma'am, what was your mindset and strategy during the actual exam? That what was the thoughts you were thinking about?
Honest, no thoughts. Actually, I was very nervous. I was prepared, but I was not this much confident. I was like, not sure what will happen, how will be the paper, because from your seniors, your friends, always, I have heard that the paper is always very difficult, and because of negative marking, all this. So I was very nervous, I would say. It was, my center was in Pune. I live in Aurangabad. My center was in Pune, and the paper was in afternoon. So we went same day. Okay, we went same day for the center, and I remember I didn't talk much. I was very very silent, quiet whole time, and in my mind I was doing revision. Okay, and I had books with me. and I was just going through. Okay. And I remember while going through, I had this pharmacy revision of saponification value or something. I read it on the way while going, and I was so happy to see in the question paper, same question was asked.
Oh
So
God.
that happened. So nothing much. I had nothing much in mind. I was nervous. I
Huh.
was a bit scared also, I can say. But yeah, after solving during exam, when I was in the hall, that time I had already decided, no, I will not be anxious. I will not be restless. I will focus. I will read well. So that time I was calm. My mind was calm. And yeah, my paper went well, really well, I would say. So after coming back from, I came running because I was very happy कि paper बहुत अच्छा गया, कुछ तो
अच्छा.
हो जाएगा कि not
Okay.
NIH, but यार था कि यार कुछ तो हो जाएगा, कहीं तो हो जाएगा admission.
Huh.
So yeah,
And then it happened. It
yeah,
actually happened.
NIH was a big thing actually.
Yes,
More
ma'am.
than me, my all, my friends, my
Huh.
teachers, everyone were more than me. They were happy that I got NIH because I think I'm the first one from Aurangabad who got
Huh.
admission NIH. Even from Marathwada, I would say, because from
Huh.
Maharashtra, from Vidarbha, we have a few
Huh.
seniors who already had admission in NIH. But from Marathwada and specifically from Aurangabad, I was the first one who got admission there. So it was a big thing. It was a very proud
Yes,
moment.
ma'am. Yes,
Uh,
it is a big thing, ma'am, and we all proud of you actually.
so much.
All right, ma'am. So, ma'am, would you like to share your experience in the NIH? Ma'am, are you currently working there?
No. I have just completed my PG, my MD from there, and not yet working because we have our NTET exam
Yes,
in
yes.
July, and then
Okay.
only we will be qualified to join anywhere in any college. So hopefully after that, I can be able to work there. But yeah, the experience was really good in NIH. NIH is, I would say, अगर किसी को PG करना है तो that is the place one should go. And even if you're not going to do your PG from there, as a homeopathic student, you should visit there once. The number of patients, the IPDs, OPDs, and that atmosphere itself is so um, contagious, I would say, for homeopathy. You will fall in love with homeopathy, and you will start to having that thing na कि और करना है और पढ़ना है. You will have that hunger and thirst for knowledge after going there. So
Hmm.
yeah, the journey was not very smooth. Ups and downs definitely there. But overall, the experience was very enriching.
Okay, okay. That's really, ma'am, important that in our OPD time, when we see the different type of disease and different type of cases, actually that will help ourselves only.
Yeah, that boosts your
Because
confidence.
yes, plus as you said, it also increase the hunger and thirst for studying. Like when we ma'am, some rare disease when we read in our textbook and then we saw them in the actual world. So it is we feel like we are lucky to see such cases.
Mm. Yeah, exactly.
Ma'am, also we have seen in some videos that the OPD in NIH is very busy and hectic. So, ma'am,
Yeah.
does it really difficult for that time of period while handling so much patients?
It is very difficult. Actually, what happens now, there are patients from rural areas. Okay,
Huh.
so patients usually travel from, different villages, they come there because it is government center. So fees is less, you get medicine for a month, and also everyday patients are there. But during Durga Puja, which is a big festival in Kolkata, and during
Hmm.
Ramzan time, the rush is
Hmm.
something, I have never seen this much patient in here and at any time. The first time in my first year when I saw it before Ramzan, the crowd was so huge,
Huh.
and we came to know later that the patient count was 4,000. So we were surrounded by
Oh God.
patients, all patients, and OPD starts at 9 in the morning, and we were sitting there
Huh.
seeing patients back to back. And when you are in first year, you are junior most. Okay. So you can't say no to any patient. You have to see, and you get more patient during that period. So we were sitting and started at 9, and no break. No break. If you want to use
Oh.
washroom, you can go. Otherwise, there is nothing like lunch break or anything. No, nothing. You have to sit
Oh
there
my
till last
God.
patient. You have to be there till last patient. So OPD used to get finished by 4:30 that way. So it was very hectic. It was very challenging actually, because we are not used to sitting for this long without food, without break.
Hmm.
But then that was in very initial period. Later, we got habituated with that, and asking question in Bengali was also a difficult thing.
Huh. Huh.
But that was we are not we don't know that language. We're not fluent in that language. So adapting, knowing that language, learning that language took a bit time. But later, when I was in third year now, it used to be very easy. And in a day, we could see 100, 150 patients ekdam aram se. So yeah,
Okay.
that skill development happened during all that period. So that was
Yes. Yes.
very.
All right, ma'am. So, ma'am, I think we have covered a lot of questions, and you have cleared many doubts for the participants, and I hope many participants have learned from your experience, and this session will be very beneficial to all the aspirants. And we also wish you luck for your entered exam, and
Thank you so
then
much.
when you clear this exam, we will again have the.
Sure, sure.
Okay, ma'am. So, ma'am, for the last, would you like to give aspirants?
Your voice is breaking, Dr. Mansi.
Hello,
Hello, I can't hear you.
hello. Am I
Yeah,
audible to you
audible
now,
now.
ma'am?
Audible, yeah. Your video is not clear, but yeah, you are audible.
Yes, ma'am. Please,
Yeah.
please wait, ma'am. I think network is there. Hello. Yes, ma'am. Am I
Yeah,
audible now?
yeah, yeah.
Yes, ma'am. So, ma'am, I was saying, would you like to give a single line advice to the future aspirants?
Yeah, I would say that, see, consistency and revision is the key. So don't give up. You can do it.
Hmm.
That is only I can say. And
Okay, okay. Thank you
I
so
wish
much.
them all the luck for their exam, for their future. And
Hmm.
as you already told about the channel, so we have that playlist. If they're interested, if they want to learn all these things about materia and other subject which we discussed, already there on my YouTube channel, so they can watch. That will be helpful.
Hmm.
So at last, I would like to thank
Thank
you,
you.
Mansi, Dr. Mansi. Thank you so much for having me. It was really
Thank you.
nice to interact with you and to share my experience. I just became so nostalgic.
Thank you, ma'am. No, ma'am. We have you on this platform. It's our pleasure, and we're really proud of you. And we are very happy that we have so much talented and brilliant minds in this homeopathic field. And we also wish you luck for your other upcoming exams. Thank you,
so
ma'am.
much.
Thank you so much. Okay,
Okay.
ma'am.
Bye.